Hi fellow dental professionals, we're here to talk to you today about future direction of periodontal maintenance, digital radiography, and CT scanning. Periodontal disease is the inflammation of hard and soft tissues that results in attachment loss and destruction of bone. Diagnosis depends on clinical signs and symptoms, however radiographs are an addition and valuable tool. Clinicians can use digital radiography or cone beam computed tomography scanning. Digital radiography produces 2D images that show buccolingual perspectives and are converted electronically. This eliminates processing, less radiation, shorter exposure time. Software allows adjustment of contrast, density, size, and zooming in on an area of interest. Digital radiographs are an integral component of assessment, diagnosis, treatment planning for those with clinical evidence of periodontal destruction and can be used in all stages of care. These images can identify caries, endodontic, restorative, and prosthodontic conditions which can impact treatment planning. Probing pocket depths and measuring recession is vital. However, radiographs assess key information that can't be obtained clinically, such as bone loss and defects, bifurcations, and developmental anomalies. Other findings include morphologies, endodontic lesions, length of root. Clinical attachment loss is the calculating tool of determining severity of periodontitis, but remaining root support is another major estimation provided by radiographs. Some etiological factors of periodontal disease, such as calculus, incompatible restorations, root features, and cemental tears may also be found. The best digital x-rays for periodontal disease is periapical and panoramic images are routinely used evaluating bone levels. Full mouth surveys of periapicals have been considered a gold standard, and the same features of interest can be found on panoramic images. Limitations include superimposition of anatomic structures and projection geometry of the X-ray beam. This may cause magnification, distortion, inaccurate diagnosis. Obscurities are found in bifurcations, buccolingual bone defects. Therefore, the use of 3D imaging has increased. CBCT enables clinicians to obtain 2D and 3D imaging. All CBCT units provide axial, coronial, and sagittal multiplanar reconstructed images without magnification. These images view the teeth, jaws, and surrounding structures, which helps improve treatment planning. If settings are set correct and client doesn't move, the images are extremely accurate. The client is positioned supine, standing, or sitting. X-ray source and detector rotate around the head and complete a digital model appearing on the computer. Software allows for 2D, 3D, and panoramic views of the head and mouth and options to help focus on one area. Only dentists are able to prescribe, order, and take dental CT scans and must register at the RCDSO. Dentists who want to install and operate a scanner in their facility must obtain a permit and renew it annually. CBCT has high resolution, allowing for accuracy and precise measuring. Images can pinpoint the exact location for a procedure and capture pathology, infections, nerves, and musculature. CBCT can access the amount and shape of alveolar bone destruction. It evaluates marginal bone contouring, bone quality, buccolingual bone defects, dehiscence, fenestration, and bifurcation. And it also assesses pre-surgical implant planning for anatomical landmarks, diagnostic and treatment outcome evaluations, post-surgical results of regenerative therapy, and observes bone grafting healing. CBCT can measure gingival tissue and the width of the facial, palatal, and lingual gingiva. It can also assess lesions, deep pockets, lamina dura, and changes in periodontal ligament space. It is important to note that CBCT is best used for mineralized structures. CBCT should only be used where 2D imaging is insufficient. It is a higher cost and higher radiation, and metal artifacts such as restorations and implants makes streaks and dark zones, which affects the quality of the image and can also mimic disease. Benefits of diagnostic imaging include detection of disease and conditions that can identify clinically, confirmation of lesion and foreign objects, and evaluation of growth and development. This assists in accurate diagnosis, prevention of further disease, and an appropriate treatment plan. As you can see here, this is a client with a probing depth of 10 millimeters. Digital radiographs were used to detect bone loss. Further 3D imaging was used in the same area to gather more information for an accurate diagnosis. In conclusion, digital radiography and CBCT, combined with assessment of clinical probing depth, attachment levels, alveolar bone levels, may increase the ability to determine the treatment outcome following periodontal therapy. Thank you for your time.